Welcome to Mount Sinai Future You, a show highlighting innovation and research right here at Mount Sinai that are changing patients' lives. We begin our broadcast with the story of a family with a history of breast cancer across generations. The care and treatment they received at the Dubin Breast Center offered them a fighting chance.
Look at us all hanging out together. Look, remember this?
Everyone's smiling.
This is our favorite time of year.
This is a favorite.
I love that one.
I would say we are a family that survives and we are a family that sticks together.
Look at this.
Oh, yeah, there's Nana and Papa. We come from a big, loud family. I'm the oldest of 4 sisters, and our mother raised us, and she raised us to be strong individuals and to not be afraid of life, to take what comes your way and to succeed or to stumble, but to get back up. Some people have bad teeth, we have, I guess, bad boobs, and we get breast cancer.
By the time I had breast cancer, I had already lived through a mother who had breast cancer. So I didn't begin the trail of breast cancer alone in our family. We don't have the BRCA gene, but we've got something.
Sometimes you think, so my grandmother had it, my mother had it, it doesn't mean I'm gonna have it.
I always said to my husband, given our family history, one of us is gonna get it. And I always said, I don't want it to be me, but I really don't want it to be my sisters. So I was heartbroken.
They start to tell you, okay, so you have to go interview this doctor, interview that doctor. And I turned to my husband and I just said, Bruce, we don't have to do that. I'm just gonna call Eva and we're gonna go to the Dubin Center. I've been lucky enough to be friends with Eva Dubin for a long time. I remember when Eva was diagnosed with breast cancer, and I remember how frustrated she was that she had to go to different places to go for different forms of treatment and wait a long time in waiting rooms and things like that. And she said to me, I'm gonna change that. And I think she really has.
I didn't know that many people that had breast cancer when I was diagnosed, but I did remember that Melissa had told me that her mother was diagnosed with breast cancer when she was young. I don't think I ever told Priscilla, but she gave me inspiration. She gave me hope.
When I had breast cancer, there was no Dubin Center. I don't want to use the word lucky, but I think these are luckier times for women because there is a Dubin Breast Center.
I was not going in with a cancer diagnosis. I was having a benign growth taken out, but it felt like home, like somebody knew me. Dr. Port spent the time and she recommended some extra steps be done, and it's those extra steps that caught my cancer so early.
Knowing Meredith and Melissa and Priscilla, I can only imagine that they must have been so supportive to each other because they are such an incredible family.
When you have a strong family, you know you don't walk alone. I didn't walk alone. I'm not walking alone.
This is a family of women that have strength, they have integrity, they are kind, they give to others, they are there for each other, but they are also there for their community. These are women that we should all look up to and see how they deal with breast cancer as role models.
I would love people to know that there is a place like the Dubin Center that can help you put your world right when it feels so turned upside down.
Well, the best thing is to have family, and that's where the Dubin Center enters into it, because everybody doesn't have those things. The Dubin Center becomes that family. There is somebody wrapping their arms around you and treating you not only for the disease, but treating you as a human being.
I'm incredibly honored and am committed to anything that our family can do to further support the Dubin Center. But ultimately for us, I think it's just an amazing opportunity for us to love each other a little more and share our story.
You always look out for your family, whether it's in the best of times or the worst times, because when one succeeds, we all succeed. And I think that's what defines our family.
Breast cancer is the most common form of cancer amongst women. In our next story, we introduce you to Dr. Amy Tiersten, who offers her patients the opportunity to participate in cutting-edge clinical trials.
The ability to use your brain and your heart every day is just the best thing about breast medical oncology. We're moving forward all the time. It's only when we know that something's better than what we did before that it becomes the new standard of care, and that's something that's so exciting about breast cancer. I was really attracted to coming to the Dubin Breast Center as an opportunity to really build something. Within breast medical oncology, there wasn't really much in the way of clinical trials when I got here, and I really saw it as a gift to be able to build things from the bottom up. Clinical trials, step by step, have changed the standard of care. One of my major interests in clinical trials over the years has really been looking at novel agents and targeted agents. Clinical trials have allowed us to take away a lot of toxicity to patients who don't need it, to really select the patients who need chemotherapy. I've been here for 5.5 years now and really poured a lot of lifeblood and energy into building a research program and a clinical practice. We're able to cure so many breast cancer patients nowadays. At this point, we have a very large array of clinical trials that for every breast cancer subtype, for every stage of breast cancer, and to be able to offer patients more than what is the standard of care is fantastic for the patients and the way we move the field together as a whole. Translating that from the clinical trial arena to patient care is a thrilling thing. The essence of good patient care is giving people the time, really listening. People always say oncology must be so depressing, and I really don't feel that it is. It sounds corny, but I come to work excited every day. You see how strong people really are, and it's incredibly inspiring.
This next story is music to our ears. A talented group of musicians from the UN Chamber Music Society at the United Nations Staff Recreation Council recently held a benefit concert in support of the Helen Sawaya Fund, a program right here at Mount Sinai that provides complimentary services such as music therapy to patients with cancer. Take a journey with us now into Carnegie Hall.
This is extraordinary. It's really important that the world learns the value of music therapy, and Mount Sinai is a wonderful institution. It deserves to be recognized for its integrative approach to healing.
I'm very excited about the concert because we have some amazing musicians in one of the most famous halls in the world who are performing to raise awareness about music therapy and the Helen Sawaya Fund.
The UN Chamber Music Society always puts together concerts that have a humanitarian dimension. 100% of all funds raised will be directed towards the Helen Sawaya Fund at Mount Sinai.
I had a long-time dream to create something special for the patients to improve their quality of life and experience in the cancer treatment. We created the program, what we called Helen Sawaya Fund, that has music therapy, has an art program, has a beautician for patients, has a travel program, and has pet therapy. So this created incredible new tools for the patients to get through their treatment.
We're performing at the WOW Recital Hall in Carnegie Hall, which is, it's a beautiful hall, a very intimate space, perfect for chamber music. 5 members of the New York Philharmonic will be performing as musicians with the UN Chamber Music Society at this concert.
The very difficult part for cancer patient going through treatment is not only the chemotherapy, the surgery, the radiation, the emotional fear they experience.
Nobody really wants cancer. Nobody really wants radiation or chemo. You're grateful to be able to have this. My mind just shifted into the music that I love most. And before I knew it, radiation was over. I was never scared again after I had music therapy.
Keep breathing.
The music therapy, along with the art, with all the other things that our program offers, is addressing the emotional component. And it has had an unbelievable impact on the patient's life and experience, and has basically transformed not only the experience of the patient, but of the caregivers.
Writing is like painting with words. For some, the art form leads to a deeper expression of emotions, which is why an author and breast cancer survivor has created a writing workshop for fellow cancer patients to express their feelings during treatment.
The writing is something that you have complete control over. And so that it restores that feeling of, these words are mine, these feelings are mine, and I'm going to put it down on paper, and it gives you back that strength.
She came to us and said she wanted to start a writing workshop for cancer patients. As a cancer survivor and published author, she wanted to give back to our cancer program. This program has been the most successful program of all the programs that we offer, because the feedback we get alone from patients just talk about how incredibly supported they feel, how therapeutic it is for them in their cancer treatment.
It was great to just get my experience out on paper and also be creative with that experience. And we're all, have this one bond, which is cancer, but it becomes this beautiful thing.
It's been a way to get away from cancer. It's been a way to not have to think about, I am a quote-unquote cancer patient, and the writing makes me feel like I got my life back.
I'm incredibly proud to see the work and to see my patients have their work published. I think this book will offer new patients a form of inspiration. I think they will be able to learn from other people's experiences. It's funny, it's witty, it's not depressing, encouraging them to try writing workshops themselves or to pick up a pen and paper or journal and try writing their own stories.
About 1 in 7 men will be diagnosed with prostate cancer. Man Cave Health is a nonprofit that's partnered with Mount Sinai's urology department to provide patients with a unique sports-themed resource center as they're undergoing treatment.
In October of 15, during a routine physical, I had an elevated PSA. Had a biopsy, was told that I had prostate cancer. First you think you're gonna die, right? I don't care what type of cancer it is. I didn't know anything about prostate cancer. All roads led to Dr. Tewari. It's like, Tom, you're 48 years old. We need to remove this, and there's a 94% chance you'll never have to deal with this again. I scheduled my surgery right there and then, and 3.5 weeks later, it was over.
Men don't know where to go. Women rally around each other, right? A friend gets breast cancer. We talk about it. Men don't talk about certain issues.
I think men don't take care of their health as well. I must say men take better care of their cars than actually their bodies. And that needs to change. Man Cave Health, it's a new way of starting a conversation about issues which men don't like talking about.
Men need to know that it's okay to go to the doctor, and if we can provide them with an environment that is more male-friendly. There is going to be a 70-inch flat screen TV with ESPN, or depending on the time of day, some type of sports show. There's going to be a coffee bar. You're going to be able to go in there and eat something while you wait. It's going to be loaded with sports memorabilia from all of the 8 major, local teams. The biggest benefit of Man Cave, in my opinion, is going to be our hotline. You can call and get a live voice during normal hours, right? And if it's not during normal hours, you can leave a message and someone will call you back that you can actually speak to.
My quest is towards finding this cancer early enough where we can maintain and preserve quality of life issues.
Once we open these across the country, if we can get a male to go to the doctor for a PSA test, why not run a full blood panel? Why not get him in for a colonoscopy? That's where I think we will eventually evolve.
In our Alumni Pride segment, urologist Michael Polisi discusses his unique Mount Sinai connection, which started at birth and continued throughout his professional life. He was the first physician at Mount Sinai to perform the first robotic nephrectomy.
The Icahn School of Medicine at Mount Sinai is not just a place to go to work for me. I was born here, my family was born here, and I feel very much a kinship to being here and don't feel like I come to work every day. I feel I just come to a second home. As a child, I used to come to Mount Sinai where my father worked in the microbiology lab for over 46 years. Run around the halls and the different labs and be wide-eyed and surprised by what was being done there. Like everything else in life, there are things that shape the way that you become. The I in Icahn speaks for the fact that it's for individuals and for the ability to foster individuals and really bring and make the best physician, surgeon, researcher out of you. We trained at a time when no one knew what robotic surgery really was, over 20 years ago. And I remember very clearly a day going to sort of a seminar, and there were maybe 4 or 5 of us in the room learning about robotic surgery. People were just baffled by the fact that we could send patients home within 24, 48 hours, as opposed to keeping in the hospital 5 to 7 days, which was always the way that it was done for, since the dawn of surgery. I performed the very first robotic nephrectomy here at Mount Sinai, and that's removal of a diseased kidney. We're doing things that people never dreamed we could possibly do. This is just in a whole new era of techniques of how we do procedures and really make a difference in people's lives. The thing that I'm most grateful for from the Icahn School of Medicine at Mount Sinai is the fact that it gave me a chance to grow and it gave me a chance to become the person that I am today. To stay alive and flourish 50 years later is a feat in and of itself. Happy 50th anniversary to the Icahn School of Medicine at Mount Sinai. I'm very happy and very proud to be part of that.
Music has the ability to touch people where words cannot, which is why a group of former Mount Sinai patients with a love of music have come together to share their gift in the lobby of the hospital.
It's not just like a regular concert setting where we're in a concert hall or playing in a church or something. The most important thing to me is the patients.
I had a series of collapsed lungs last year. Obviously, as an oboe player, to have a collapsed lung doesn't really work out that well. I wasn't able to play for a while, and I kept having the symptoms. So finally, I was able to have surgery to correct it.
A collapsed lung is a painful thing to have happen to you. It almost feels like you're having a heart attack, I would imagine. It's just like, and so I was sitting in bed, and there's all these beeping and of machines. So I was just in a miserable spot, and then I was sitting there and all of a sudden I heard piano music.
You can hear everything up in the rooms up there. It's beautiful acoustic, and I had the idea, like, if someone's playing the piano down there, then maybe I can play the oboe down there. And that actually inspired me to get better faster so that I could play again and bring it back to the patients here.
I think these concerts help patients and staff and people in general who come through this community. They've included not only patients on all floors of the hospital, watching over from the balcony as they recover from their inpatient hospital admissions and surgeries and procedures, but also people just walking through in between Fifth Avenue and Madison Avenue and realizing that there is something special going on here.
Both of us were hearing the music down in the lobby, and that was inspiring for our recovery, and both of us wanted to get back to playing our instruments, and I just love having the opportunity to give music for free to anybody who walks through this lobby, anybody who needs it.
Following a bike accident that caused spinal trauma, one biker thought she may never ride again. But thanks to an artificial disc replacement, she's back to competitive racing.
I was doing a training ride in Central Park for my triathlon, and I was suddenly boxed in by 2 people, 2 bike riders on each side of me, and then someone crosses my path. I had to hit both brakes, and I flew over my handlebars going 23 miles an hour. I landed on my chin right here, so was where all the force went. I just went from riding, enjoying my Saturday, to being completely destroyed. All I could think of was, I have to run. I'm not going to the hospital. I have a run to do because I have a race to train for. When I went to the hospital, what was ultimately found was a slight disc herniation with swelling in the muscles behind it. So I was put into the neck brace for 7 weeks as a result of that. After being in the neck brace for 7 weeks, I started to go back to activity, and all of a sudden I'm in pain again. And that's when the decision for surgery came. I was in so much pain I couldn't live.
When I saw her, she was just tearful. She didn't know where she would go from here. She thought her life was wrecked, couldn't move her arms well. She was in a lot of pain, and clearly there was psychological trauma from what happened to her.
And going into this conversation with Dr. Chowdhury, I wanted him to understand the importance of staying mobile, staying active, and I wanted that for the rest of my life. We decided that the artificial disc replacement was the best solution.
So the procedure we selected for her was to, again, decompress and remove the disc, but as opposed to fusing or locking that area, we placed a mobile part or a mobile disc in there that would allow her to retain her normal range of motion, for it to be fluid, not be in a collar for long periods of time after surgery, and to continue with normal physiologic motion, so the other discs would also be, in theory, be protected. Both surgeries are successful, but when we do a fusion, we rely on the body to heal their native bone to the bone graft that we put in, and that's a process that can take 3 months to even 6 months before you allow patients to really be very active. When we do a disc replacement, there's a small amount of healing that has to happen between the bone and the implant that we put in. And that only takes, a week to a couple of weeks maximum. And you don't have to be in a collar and a hard brace. And you can start physical therapy, range of motion, and kind of get your life back soon.
Amazingly, it's been less than a year, and I have already been able to race twice. I feel great. I couldn't be happier for electing to do that surgery. It's always a hard decision, especially with spinal surgery, when there is a chance that disc could have healed. But I did not have the time to wait for that. I feel blessed, I feel lucky, and I'm so thankful for not only Dr. Chowdhury, but everyone here at Mount Sinai. When I crossed that finish line, I dropped in tears, because who does that?
Tendon injuries are painful and prevalent among athletes. Researchers at Mount Sinai are studying how certain molecules can lead to a regeneration of tendon cells.
I think for a lot of the orthopedic conditions, people just tend to think, oh, that's just what happens with age, right? But it doesn't have to be that way. As we are trying to understand the basic biology better of healing, I think we can at least shorten the time that people are not able to do the things that they love, or be able to kind of return them to those activities. My lab studies tendon healing. Specifically, I'm trying to identify situations where tendons heal well versus situations when they don't. For example, what is a tendon cell and what are the markers that these cells express? We are hoping to identify the molecules that are important for adult tendon cells to be able to kind of reactivate and make new tendon. Tissues, tendons, and ligaments, they mostly heal by forming a scar tissue. I think we can at least shorten the time that people are not able to do the things that they love. We're driven by what we do out of curiosity and love of science, and I'm really lucky to be able to do that every day.
Mount Sinai trustee Arnie Glimcher has offered philanthropic support to the Mount Sinai community for many years, including a recent art commission on display in the lobby of the Hess Center.
I think art can help all people, whether you're sick or not sick. It can enrich one's life and experience. Arnie Glimcher asked me if I was interested in doing something at Mount Sinai. I've known Arnie for a long time. It's a quarter of a century, at least. He's an extraordinary dealer who works for artists, and I was delighted to be asked. Both of my grandchildren were born at Mount Sinai. My family's been here, so it's nice to be able to participate on some other level. But I wanted something that was really lively and uplifting. I picked a very vibrant red because I thought it was buoyant. I think it represents action and projection of thought and a kind of optimism, and it gives them a certain sort of moment of enjoyment and pleasure and interest and thoughtfulness. It's a privilege to be able to integrate a work into our community. It's particularly meaningful for me to have something in such an important place as the Hess Center.
Thank you for watching Mount Sinai Future You. Be sure to follow us on Facebook and Twitter for updates on our next episode.